Let's take a patient through the outpatient process, beginning with registration. So the patient registration module I have just opened is what the registration clerks will be interacting with. So let's say our patient is perhaps 50 years old, maybe female, and has provided a phone number, and we can say where they live, perhaps rural. Let us now add our patient to the outpatient consultation queue and specify a consultation charge of 500 shillings and say they will be paying with cash. Now, if you are a registration clerk as well as a cashier, then this form pops up. So for now, I will close it so I can demonstrate how the cashier interacts with the payment module. Now, before sending our patient to triage, we should advise them to go make a payment, and the cashier will open the payment module. There will already be an existing invoice, and let us proceed to post the invoice and receive payment. Payment mode will remain cash. As you will notice, I have not changed it. At this point, a receipt is printed. Now we can proceed to triage, and there our patient is listed at the top of the queue. So let's say create a new encounter and add our default entries. So let's say our patient's weight is 66 kilos with a height of 167 centimeters, BP of 120/80, temperature of 36.6, and a pulse rate of 87. Now, assuming the weight was within the range of obesity, so if I change it to 80, you will notice the weight is highlighted in a different color and BMI has been calculated appropriately. So now that our nurse is done with triage, we will close the triage form and close the nurse module altogether and proceed now to consultation. So the clinician will primarily interact with the outpatient module, and we can find our patient listed at the bottom of the queue. Let's create a new encounter. The first thing we will see are the vitals before we start documenting our chief complaints. So let's say our patient is presenting with chills, fever, and maybe some headaches. We can then proceed to write our history of presenting illness. Perhaps our patient has been sick for 5 days, having recently traveled to Kisumu. Now, after documenting our chief complaints and history of presenting illness, let's go to investigations and request a lab test, say malaria. Let's also request a chest x-ray, and then send our client to the cashier to make payment. But before that, we will close the treatment form. We will close the treatment form and then close the outpatient module and open the payment module. Now, you will find that the invoice already exists, and we will select it post invoice, and as you can see, it has been populated with the chest x-ray and malaria lab test. Again, payment mode remains cash. Okay, so we submit it and close the payment module. Now let's send our patient to the lab, where we can see our test has been listed at the top. So we'll double click, receive our specimen, specify a result, and save. Let's now proceed to X-ray and write our findings in the text area and save. Okay, so our patient now goes back to the clinician. We can as well search by name. Continue with our encounter. Now that we have our investigation results, let's in fact first look at the investigation results. So under the investigation tab, we have lab test, and we can see the result listed there. Same as imaging, the findings will be listed there. Now, diagnosis. So let us say this has been confirmed to be malaria, and it is a new diagnosis. Now, after our diagnosis, of course, is treatment. So perhaps we should include some painkillers. So let's say brufen tabs. And maybe some coartem tabs. At this point, we close our clinic session and advise our patient to proceed to the pharmacy, where the pharmacist will primarily interact with the pharmacy module. When we open it, we'll see our 2 prescriptions listed at the top. So we double click to take us to the order grid. So let's see if we have brufen in stock. We do. And do we have any coartem tabs in stock? We do not. So we can advise our patient to go and purchase the coartem tabs at another establishment, and if they are taking more than the auto-calculated tablets of brufen, we can change that here and advise them to go and make payment for the brufen. So the cost is listed there, 100. Now let's close the pharmacy module and back to the cashier we go. Post our invoice. Select the brufen tablets, submit, and back to the pharmacy we go to collect our drugs. And you can see the color has changed to green, indicating payment has been made. So the last step is to dispense, so the stock can be taken care of. And that is the outpatient process flow in a nutshell.